I'm Alexandra Nelson. I'll be presenting on alcohol liver disease, or specifically alcohol-related liver disease. As I will go into, these are all of the diseases or the disease of the liver that is caused specifically by alcohol abuse. So for the introduction, alcohol liver disease is an encompassing term, as I said before, for the forms of liver disease that exist related to alcohol abuse. It has been shown that alcohol liver disease is the leading cause in cirrhosis, liver cancer, and acute and chronic liver failure. Long-term alcohol abuse will lead to the replacement of those healthy liver tissues with scar tissues that result in the different variations of liver disease. Alcohol-related liver disease typically occurs in three main stages. They're known as the fatty liver stage, the alcoholic hepatitis, and then liver cirrhosis. There's a picture right below the introduction, if you can see, that tries to show the stages. In stage 1, fatty liver, it's also known as steatosis. It is characterized as an excessive accumulation of fat in the liver cells, usually achieved, as I said before, in early stages, and is reversible if the alcohol use is stopped. This is because the liver can regenerate cells, so if the alcohol abuse is stopped in this point, it can reverse and create more healthy liver cells. Stage 2, alcoholic hepatitis. This is when inflammation of the liver occurs. It leads to the degeneration of the liver cells. During this time, jaundice is most common with symptom of onset. I'll go in further on to the clinical manifestations or the diagnosis later, but that's just a general thing that people see during alcoholic hepatitis. Lastly, liver cirrhosis, which is stage 3, is the permanent scarring of healthy liver tissue. In this case, symptoms include confusion, bleeding from veins, and abdominal distension. So going into the pathophysiology and the diagnosis, the pathophysiology of alcohol-related disease is not completely understood. There's a lot of science looking into how the body and the liver processes alcohol, but the entire pathophysiology is not completely understood. However, it is known that 80% of the alcohol consumed passes through the liver to be detoxified. Furthermore, chronic consumption of alcohol will result in the production of cytokines, oxidative stress, and acetaldehyde toxicity. This is what is occurring in your liver cells as alcohol abuse occurs. This will cause the inflammation of the liver cells, as we talked about earlier, leading to apoptosis and eventual fibrosis. The liver can also regenerate even when 75% of the hepatocytes are dead. Like I said, once you're in stage 1, you can reverse it if you stop drinking as much. Diagnosis of alcohol-related liver disease typically occurs or coexists with the stages of alcohol abuse and the progression of the disease. So in the first stage, persons usually exhibit almost no abnormal findings, and fatty liver may actually be discovered during routine health checks showing elevated liver enzymes, so your elevated ASTs and ALTs, or any imaging that may be used for that purpose or another that could show concerning findings. If there are concerns for acute findings, a liver biopsy can be taken. In this case, findings are not distinguishable from non-alcoholic fatty liver disease. Steatosis can resolve after cessation of alcohol use, but if alcohol use continues, the patient's symptoms will continue to worsen. In this case, they will have onset of fever, jaundice, and hepatomegaly, as well as possible varices and ascites, which is getting into the worst parts of liver disease. Treatment then is the question. There still needs to be a lot of work done on the treatment aspect of alcohol-related liver disease, mainly because there needs to be a shift in focus on this disease, in my opinion. But there are 4 main categories of treatment. There's abstinence, nutritional support, pharmaceutical therapy, and liver transplantation. So to start looking at abstinence, obviously that's the biggest answer. Cessation of alcohol use is at the root of prevention and treatment of liver disease. Baclofen has also been shown to be helpful in coping with alcohol use disorder and has shown no known contraindications with alcohol-related liver disease, although there does need to be more research done to confirm these findings. The problem with abstinence in people with alcohol-related liver diseases, they're probably already at the point that they're very addicted to alcohol. So asking them to become abstinent can be extremely complicated. So baclofen can help in conjunction in trying to stop using alcohol as much as they were before. Nutritional support is another large treatment / also a way to just help with the symptoms. So up to 60% of those with ALD and almost all those admitted show evidence of malnutrition. This will exacerbate their symptoms of ALD. Forms of malnutrition are linked to, they show low dietary intake because they're consuming a large amounts of alcohol, lack of appetite that may be related to like esophagitis, like GERD type symptoms, or poor dental condition, bad malabsorption due to diarrhea caused from alcohol use, and complications of liver disease such as ascites, as well as dehydration. Pharmaceutical therapy, right now at this point, there's no known therapy to specifically target ALD and cirrhosis fibrosis. Milk thistle was like a wives' tale type of thing that was suggested as a liver protectant, but the results have not been clinically significant to show that it actually helps with liver disease. This is a large part of the issue that I will go into with the societal response. Is there's a large disconnect almost between this alcohol abuse and a disease, and right now we haven't really found a quick treatment or a quick answer, and so working towards finding more pharmaceutical therapy would be helpful in making progress towards helping people deal with this disease. I just threw in a little chart right below that just talks about the average amount of sizes for one serving of alcohol and how they range depending on if it's liquor or if it's wine, beer, etc., and then how it also ranges based on how your body intakes it, so male versus females in general, as well as you have to take into further account, this is very generalized, so you'd have to also take into account their health, their obesity, if their health, their BMI, and those sorts of factors to see how they also would process alcohol. So now to get into the societal response, actually we'll go over the epidemiology first. Alcohol use disorders contribute to a large proportion of the liver disease deaths. So according to the Global Burden of Disease, there's been a steady increase in the amount of liver disease deaths, with 1 million reported in 2010, which is about 2% of the global population. Determining the proportion of alcohol-related disease mortalities globally, however, is harder due to difficulties with reporting in other countries. Although it was reported in Finland that 80% of the liver disease mortalities were related to alcohol. Furthermore, the WHO reports that throughout European countries, 60% to 80% of the liver-related mortalities are due to alcohol. Additionally, excessive alcohol use is the second most common indication for liver transplants, with 25% of the transplants in the U.S. related to alcohol. So it's obvious with these numbers, especially the shocking one in Finland, and then 25% of the transplants in the U.S. occurring due to alcohol, that this is a huge issue that needs to be tackled. And it can't be tackled just focusing on one aspect, because it encompasses so many factors that lead to the progression of the disease. So this turns into the societal response. In this case, the societal response is, as I mentioned earlier, somewhat lacking. There needs to be a more focused approach that works to understand the root of alcoholism in these patients, working on the psychiatric and psychological aspects of it, to work to find treatments, as well as other clinical methods to improve the condition of the patient prior to the stage at which a transplant is needed. Currently, however, what I found in regard to societal responses was education. It was the most largely evident source of information, such as these diagrams, and trying to inform students at young ages to be conscious of the side effects of alcohol, etc. Like I said, diagrams on proper amounts to drink and understand the stages and progression of liver disease. There's also been a formation of community groups to work through and understand the disease, as well as to understand the symptoms that have become prevalent. A lot of cases, I feel like people almost aren't even not coherent, but they're not in the right state of mind to understand the side effects that could come from what they're doing to their body at that stage. Therefore, overall alcohol use disorder and thus alcohol liver disease is extremely prevalent. The symptoms worsen over time, often leading to death. A lack of therapeutic options and focus on access to preventative care are concerns that must be addressed to accurately tackle a disease that continues to increase in mortality rates. Furthermore, as shown, ALD is a fully preventable disease. It is imperative to educate on the importance of preventative care and understanding the different circumstances that will shape patients' decisions currently and in the future, so that they're aware of the effect of their decisions on their health. So now to answer my 2 questions, I was asked the amount of time that people have to abstain from drinking, which is a great question in order to get a liver transplant. It is required that you abstain from drinking in the U.S. for 6 months. This is so that the medical world knows that this person is taking the steps necessary to be able to resist doing the same thing to the next liver that they get that they didn't have before. Also, obviously, there's not an ample amount of livers around, so we need to make sure that this candidate truly is ready to make a change in their life, so that they're not taking this liver away from someone that could have been ready instead. My other question was why I was interested in this disease, which is I feel like kind of came throughout this presentation. But more so, I think COVID kind of largely formed my decision to choose this topic, since alcohol consumption has increased. They said numbers somewhere in some places throughout the United States, alcohol purchasing at like ABC stores, etc., had increased 500%. I think it would be interesting to see how the group of individuals dealing with COVID right now, how their liver health goes throughout the rest of the time, and if people who are chronically drinking right now are able to reverse their decisions and have new cells regenerated in their liver, or if these will form alcohol abuse habits that persist throughout the rest of their lives. I also just think there's a lot to learn about liver disease. It's not a quick fix disease. You can't just give someone, other than giving someone a new liver, which also comes with lots of complications, there's no way to really help someone deal with a lot of the symptoms, and it's a very terrible disease, and you just see a lot of patients with insane amounts of abdominal distension and lots of pain, kind of deteriorating. And I feel like what I've gotten is that a lot of patients also aren't truly aware of this stage that they're in and how this disease is going to progress. So I think that education and societal responses are constantly changing and constantly improving, but there needs to be a lot of work done to the people that are in end stages, but also in the preventative world, so that we can make these changes early and encourage routine checks to know that if someone has slightly elevated liver markers, that we can make a difference then rather than later. And that's it. Thank you for listening. I hope you learned something about alcohol liver disease today.